Hello, everyone. Greetings, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across four Indian cities, reveal that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occurs mainly in women, which is 90%, and 10% of all male ethnic and racial groups. According to 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation is generally ignored as a sign of aging and often is misunderstood as a skin condition. Melasma sufferers has been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration setback in treatment. To avoid these hassles and to keep you informed, today we are here to know more about melasma and its management from our expert. Dr. Mithra Vasanth Vignesh, MBBS, MD, DVL, is a highly accomplished dermatologist with a strong focus on clinical dermatology, research, and scientific writing. She completed her MD from a government Stanley Hospital and Medical College, Chennai in 2020. Dr. Mitra is the founder and chief dermatologist at Cutis Parasol Skin, Hair, Nail Laser Clinic and also serves as a consultant at multiple hospitals in Chennai, including Koveri Hospital, Apollo Clinic, and Aishwarya Hospital. With expertise in handling advanced laser technologies and cosmetic procedures, she specializes in treating various skin and conditions. Her research contributions have been recognized nationally, and she has published multiple papers in leading dermatology journals. Dr. Mitra is actively involved in organizing scientific conferences and continues to innovate and innovate in evidence-based dermatological practices. Today, we are privileged to have her here with us, and she will be sharing her insights on melasma and its management. We extend our heartfelt gratitude to you, madam.
Thank
We would
you.
like to start with the first question, which is what is melasma in your language?
Firstly, I would like to thank you for a kind introduction. Yes, let's get into the topic. Melasma. Melasma, as mentioned by our host, it's a pigmentary disorder which is more common among women, and majorly women in postmenopausal age group gets affected by this. And the pigmentation, maybe we call it at different level, like epidermal. Epidermal is when the superficial layer of skin is involved. Dermal layer when little deep also the skin is involved, and there's something called mixed where it is both epidermal and dermal. And the major cause is like sun exposure, UV radiation. Apart from if you have a family history, and there are certain some patients get it during their pregnancy also, we call it cocolasma of pregnancy. So it is majorly a pigmented disorder, and as already mentioned, Indian skins are more prone to pigmented disorder. That's the reason we ask them to apply sunscreen more than prevention of skin cancer.
Right. Doctor, specifically talking about Indian skin we are
Yes.
right now because there are a lot of pigmentations happening in our skin. So how do we actually understand that this is melasma? How does the initial stage look like?
See, melasma is asymptomatic, as in you don't have any symptoms except that it's visible pigmentation, which may be at
Hmm.
different parts of your face. So mostly the ear, the cheek areas where it is very common over the zygomatic, the place where I'm touching it right now, because this is little, more concave and it gets exposed to the sun exposure compared to other areas. There are people who get it all over their face, even over their forehead, their eyebrows, and even on the other areas of face. Melasma can happen, and it doesn't give you any trouble, except for that it is going to decrease your confidence level by making it visible for others. So when a
Hmm.
patient, and it's common in postmenopausal age group, when a woman at post their menopause, they come with this pigmentation, and there are other pigmentary disorders on your face which may mimic like melasma. like if you have an allergic reaction to an hair dye, or you have any other pigment, like even acne pH, all those are spotted. But melasma is more of patchy always. It's like a patch, and it will be like
Hmm.
blotchy also for certain people. So that's how you figure it out. It's a visible pigmentary disorder. It is not like going to cause any trouble like burning or pain or anything like that.
Right. So, doctor, we all know that treating any condition, any disease, is much more easier in the initial stage. So, what if somebody is confusing it with freckles? How does the spot differ from freckles, if we
See,
particularly ask?
freckles are again, it's very common over the sun exposed areas, and it will be like tiny
Hmm.
dots kind. Okay, some of those freckles may be little larger, and those are called lentigens. Okay, so it will be like a mole. The lentigens will be like a mole. But what you need to understand is freckles will usually very common for people of type 3, type 4, which is generally not our Indian skin type, which is type 4, type 5. Okay, type 3 and type 4 are, and in your Western population get those freckles. You would have seen in the on Western people's
Hmm.
skin when they
Right.
have those tiny dots, browns, dots. Those are called freckles.
Hmm.
They generally fade with winter for certain people, and they respond. Applying sunscreen regularly will really help in preventing the freckles from coming. Whereas lentigens is totally different part of freckles, which is actually a permanent thing, which is more common among aged people. It will be like a mole, it will be little larger in size. They do not respond to just regular application of sunscreen. Again, that will be also like a mole. Whereas melasma will be like a patch. So it will be totally different. The presentation will be little different.
Right. Now, speaking about hyperpigmentation again, doctor, what is the difference between melasma and hyperpigmentation?
See, hyperpigmentation is a very broader term under which melasma is one of the conditions. Okay.
Right. Hmm.
Like hyperpigmentation can be because of any other dermatological issue. Also, probably a patient got acne. Then the acne has left a mark with the pigmentation. It's called pigmentation again.
Hmm. Hmm.
Excuse me. And also, if they have any, for example, there's something called drug allergy where that area leaves with a pigmentation. That's also kind of pigmented disorder. A person who's having allergic reaction to hair dye or allergic reaction to the amutagen or whatever astringents they apply for the pain, that also leaves a pigmentation. Or someone gets hurt, or someone gets injured and the skin, even the deep layer gets abraded, that may leave a pigmentation. So it is like totally different disorder. Like melasma is one of the pigmentary disorders under which this melasma itself can be of different types. That's it. So you don't have to, you cannot say hyperpigmentation, you cannot differentiate hyperpigmentation from melasma because melasma comes under hyperpigmentary disorder.
Right. Right. So we can say that all melasma is hyperpigmentation, but all hyperpigmentation is not melasma. That's what we
Not
can say.
melasma. So that's when you need the help of a doctor. You cannot make the diagnosis saying this is melasma also.
Right. Uh, Now, moving ahead, doctor, what can be the risk factor? As you have already mentioned, that there is no such an certain botherance which can this condition cause to the patient. But apart from that, the confidence, of course, they would lack in confidence because it's the facial area. What are the other risk factors, or are there any risk factors apart from
Yes,
this?
definitely there are some risk factors. One is like majorly we contribute for UV exposure, this is ultraviolet sun radiation. And also the
Hmm.
other thing is patients who are on oral contraceptive pills, they have the risk of getting melasma. And patients
Hmm.
who have a family history of melasma are more prone to get, irrespective of the sex. It's not only female. If they have a family history, even men tend to get melasma. And another thing is postmenopausal itself is a risk factor because your estrogen is gone. Estrogen kind of protects you from these pigmentary disorders. So when that goes down, you get these pigmentary disorders, which is very more common. So we cannot say it's as a risk factor, but it's more common among postmenopausal people also. And there is again, as I mentioned already, colostoma, which is during pregnancy. Some people may who have the risk of getting melasma postmenopausal may also get this pigmentary disorder during their pregnancy itself.
Right. So, how do we normally diagnose the condition?
It's majorly a clinical diagnosis where we don't need, it's just your experience, and Probably, if we have to differentiate whether it is epidermal or dermal melasma, we see it through something called Ujjalam. We use a device to differentiate it. That's it. So it's majorly a
Right,
clinical diagnosis based only on your naked eye examination.
right.
Just to find
So
the type of melasma, we use a device.
right. So because we are talking about diagnosis here, we because we are talking when we are talking about our skin, we know a lot of people who tend to get the products from the market and then apply it on their own, and then they'll ask their chemist, and just because they'll see a mark on their face, they'll apply. There are a lot of products in the market. Let's not name any. But how can it be harmful when we are particularly talking about melasma today? How can such over-the-counter products be harmful for the condition?
See, for a person who has been following a skincare routine religiously, they might be applying sunscreen regularly. They are more, like they're little more on the protected side for getting melasma. Whereas this is going to be a common among a population who hasn't bothered to take care of their skin, who hasn't applied
Mm,
sunscreen. Okay, so that itself leaves them to an area where they are not. Vigilant enough to take care of this thing. They are not even aware that there is something condition like this. So when such people go take the self medication from pharmacy and stuff, they are misguided by giving creams which may work for a short while, which may give them excellent result for a short while, but it will come back stronger, damaging your skin, which is really called which is very common among women who take skin lightening creams from a pharmacist, which has steroids, which has mercury, which has gold, and these tend to steroids will damage your face, and it is going to leave a really bad skin on you. That's because of using steroid for a longer time. And mercury and
mm,
gold are more known to cause the skin lightening, whereas it can also injure your kidney. So it is
right.
better you go meet a concerned specialist, a board certified dermatologist, and get your clinical condition diagnosed. Get a realistic, perspective of what treatment options are available, how much to expect, what to expect, and how long it is going to stay, or how long it is going to, and how long you need to be under treatment. You just have to clearly talk to your doctor about that, so that you do not get carried away by a lot of misinformation that is available in the internet.
Right. Because you're talking about this, doctor, another set of society nowadays, just the other day, I saw a video where the salon lady has become a dermatologist on her own. So basically, they are actually giving medications to their patients, and they also claim to, give glass skin. We don't know what are they doing for it, but Korean glass skin has nowadays become a dream for everybody. Everyone wants a Korean glass skin. In such manner, they are visiting the parlor, the salons, and they're getting self treated. Or there are a lot of treatments, say chemical treatments, laser treatments available in the salon nowadays. So, can these treatments be a easy solution to it, or should we only and only trust our dermatologists?
See, definitely this is not an easy solution. Okay, definitely going to an unqualified individual just seeking an easier track, thinking it is going to respond, it is going to give you you're saving your money, you're saving your time, you're saving your energy. If you think like that, it's actually on a longer term, it is going to affect and come back. It will in the form of damaged skin. The difference is just about anyone can bake a cake. It's all about a baker who knows what he's putting, how much he's putting, how much he can do it. Similar to it, a doctor knows how this comes in what the what level it has to be handled. Whether the patient may the skin type or the we take multiple factors into consideration. I may not give the same treatment for a melasma patient. Like the patient A might be giving I might be considering a different molecule for treatment. Patient B might be different molecule for
Mm,
different reasons. Their occupational exposure I should take into their consideration, their level of dedication, whether they might follow it regularly, there are certain things which needs religious protection from sun. So we need to be really careful. We really read patients from top to bottom to understand whether they'll be able to do it or not, and we also give them a
mm,
realistic scenario, like what is going to be your response. See, melasma is one condition. It is all about, it is not something I give a treatment, it is gone forever. It requires maintenance. Skin is always something called, uh, you know, it requires maintenance. That's what it is all about. You need to do it on regular basis to keep it under control. You're getting
Mm,
exposed to sun on everyday basis. You're aging on everyday basis. The pollution, everything, whatever you're getting exposed to, skin is what taking up. So you need to give the care on regular basis. So do for melasma also, because melasma needs a maintenance. I treat the pigmentation which has already come. I give you certain products to protect you from not for the from the patch not come back again. But you need to keep it use it. You need to keep using it regularly to keep it under check. So there is no
right.
shortcut method, and it really takes time. And you need to go to a qualified, board certified dermatologist. Go ask your doctor whether he or she is a dermatologist. I'm not talking about cosmetologist. There are a lot of people going around in the name of cosmetologist. They are not the qualified people. It's only a dermatologist, and a dermatologist will always say they are a dermatologist. So just check the degree before you go to a doctor.
Right. Now, because we are talking about the maintenance of melasma, we will come back to the further question, which everybody what might be wondering, that is melasma curable? We'll come to that. But before that, tell us about the maintenance of melasma. What kind of skincare should one maintain if they are prone to melasma? Like you have already mentioned, somebody from your family, if has it, it can. It is possible that it can come to you. So, what kind of maintenance for them? And we are particularly focusing on sunscreen again and again today. So also tell us, how important is it, how much to use, how to choose the right sunscreen for us.
Okay, so generally it is one of the, see, sunscreen is a protective agent. Okay, it is going, as I
Mm,
already mentioned, UV radiation is one of the reasons, and you need to protect your skin from UV radiation. So you're applying a sunscreen, and the sunscreen has to be applied on everyday basis, irrespective of the weather condition you are in, whether it is raining or whether you're staying indoor, whether you are only cooking in the kitchen, but you need to apply the sunscreen. Okay, and it has to be applied 3 hours once. Practically, it is not possible, but I generally recommend my patients to apply it at least once in the morning, once in the afternoon. And you need to
mm,
apply to finger level, which is like your finger level to finger level, which will give you adequate protection for your face, neck, and your ears. Okay, we as in recent times we are more towards tinted mineral sunscreen for kind of this melasma patients, because one thing, tinted sunscreen gives you that camouflage effect for the melasma also, so that you look
mm,
little brighter. And also it has it has certain ingredients, iron oxide basically, which also has a role in reducing the pigmentation. Okay, and mineral sunscreen is what we recommend because it is also long lasting, and it doesn't, even if the patient doesn't reapply, it is better. It can give you an extended level of protection. So I first sunscreen is the first thing to go for a melasma patient.
right. What are the other things we can add in our skincare regime?
Yes. So
We know a lot of
I
products are available.
Yeah, I
Right.
usually do not prescribe more than a sunscreen in the morning, because I just want it very easy for the patient so that they'll be very compliant about using it regularly. So morning and afternoon, I usually restrict only to sunscreen. But coming from Chennai, Chennai is a very humid condition, so I do not recommend
Mm,
applying multiple products. I ask them to just apply a good tinted mineral sunscreen if it is a melasma patient, and I give them the shade depending upon the skin tone. And coming to their other care part, I there are certain regimens which we give for melasma patient, which is going to prevent the pigmentation formation. Okay, it is going to work on at that level, at prevent the melanin from getting formed through certain molecules, and those are in the night routine. I combine it depending upon there are multiple multiple products which we use, and they might be AHA, BHA, or they might they're like we call it glycolic or
mm,
lactic
mm,
acid,
right.
mandelic acid. Vitamin C really works well, and there are multiple molecules which we really use for these patients. We give them retinol also, so bakuchiol, all that will work. But it's all about how we combine it, how we understand the patient, what skin type they have. There might be a patient with melasma as well as a dry skin, so for them I wouldn't recommend certain ingredients. So
Right.
it varies. I cannot I have to customize it for every patient.
Right. Uh, Doctor, we know that the skin being the largest organ, there are a lot of changes happening in our skin. Also, we know that we look like the way we eat. तो आप जैसा खाते हैं वैसा आप दिखते हैं. What about diet? Does diet also plays a very important role when you're talking about melasma?
Yes, definitely diet plays a major role. Antioxidant rich diet is going to help you in reducing the pigmentation in one way. Okay, and again, an antioxidant rich diet is also protective from UV radiation. It's going to give you that natural protection from UV radiation. A person in general, anyone, be it at any age, it's better they include a lot of fruits and vegetables in their regular diet, and also include some kind of if they are a non-vegetarian, they can include fish, which has which is a good source of collagen, also which helps in aging factor. So all that together, antioxidant rich diet, which generally includes any kind of nut, eat anything healthy, it has some amount of antioxidants. Okay, but for melasma patients in general, we do prescribe oral antioxidants also apart from the regular diet. We feel the level of damage that's been happening cannot catch up with the uh, diet form of antioxidants. So they need a prescribed dose of antioxidants. So we know that they get it because they also have a role in the reducing the pigmentation. So we prescribe oral antioxidants for these patients.
Right. Doctor, we also try a lot of home remedies on our skin. We tend to have this habit because, being from the Indian society, of course, we tend to apply everything we eat on our skin. So, are there any home remedies for melasma? Does it work, or should we just stick to the suggestions, the expert advice?
No, see, the reason why we do not, prescribe home-based, we do not encourage home-based products, I mean, home-based remedies is because it's as simple as that. Why do we cook and eat? Because that's how your gut can take it. It's as simple as that. If things
Right.
can be taken raw and everything, or we can just apply it. And the products, the ingredients which are used in these skin products are not like something we go to Mars and pick it up and then put it in these products. No, it is something around you only. We are just working on. There are these are extracted from tomatoes. These are extracted from grapes. These are extracted in everything around you only, and they are formulated in such a way that your skin can take up without getting any irritation. No one go picks up cabbage and eats it like that. They need to cook it similarly. Your the cooking part of is what the formulation does. It makes it skin friendly. It makes it very friendly for the skin pH so that your skin doesn't irritate, as well as make the molecule optimum enough to act for what I mean. The intention for what it has been given, it has to act. It has to do its mechanism of action. For that, it is formulated in such a way. So it's always better to opt for a prescribed, meet a dermatologist, get your routine sorted and your treatment sorted. Never resort for all these home-based remedies. I'll just, you can apply, you can take a lot of curd, you do not apply it on your face. You can have lemon juice, you do not apply it on your face. It's as simple as that. I did see some questions about honey, lemon juice, drink it. Whatever goes into your stomach, please drink it or eat it.
Right. Doctor, we have also heard a lot of people saying that melasma can turn into cancer. So, how true is that?
No, no, no. Melasma. See, in general, the Indian population has since it's just that we have one gifted thing. We are much protected from skin cancer compared to Western population because of a type of skin. There is our we have more melanin, which gives a natural protection from cancer. Okay, and the more melanin is the reason why you are more prone to pigmentation disorder also. So melasma changing into cancer is not possible, but a cancer patient having melasma is highly possible.
Right. Well, for all the people who are watching us, who are in their 50s or late 60s, who are already suffering from melasma, I personally have met a lot of people in my life who has asked me, ki, this is not going now. It's going to stay with me forever. They have basically given up. So, uh, the big question comes up, doctor, is melasma curable? Can it be permanently cured?
I cannot say it's a permanently curable, but it can be kept under control. See,
Hmm.
you get the treatment, the pigmentation fades off. The problem with patients is they just stop the treatment right there. They think it's gone forever. See, pigmentation is something which is gonna again get produced and come to the top of your layer of the skin or in mid layer. Okay, so you need to always keep it under check. You need a check post there, which has to do reduce that melanin production. There should be some products to keep suppressing the melanin production over that area and applying sunscreen regularly. One common thing about postmenopausal women having melasma, even without family history, is there are patients who use hair dye. Hair dye is one of the things which rather more than it causes melasma, it's going to increase the existing melasma. So you need to go for a safer hair dye, which I really wanted to highlight, because when we talk about postmenopause, they definitely need hair dye also. But just go meet your dermatologist, get a very safer hair dye. Try to reduce its frequency as much as possible, even though it is safe. We never know which molecule is going to show up later as an triggering factor for melasma. So try reducing the frequency as and when you have an important event, you can apply and use a proper whatever your doctor has said. They would have told you can use this for maintenance. Meet me 3 months later, because we'll just see after 3 months later if there is any sign of increase in melasma. Again, you go beat it hard. Trust beat it hard that time. Again, keep it under control. So it's all about maintenance. There's nothing like a permanent cure. We need to keep it under check. It's all about brush. It's like brushing your teeth every day to keep the germs away. Similarly, you need to do this to keep the pigmentation under control.
Right. So all you have to know is that it is a part of you now. So you have
Yes.
to take it along for the rest of your life and cherish it. Of course, as doctor has already mentioned, that it can be controlled. It can always be kept under control if you are into medications. But tell us, doctor, what is the rate of reoccurrence? What if the patient is under special expert advice, and he or she can see noticeable change in his or her skin, and after a few days the patient actually stops taking the medication, can it come back to the same state again?
Yes. The faster it goes and you're not keeping it under control, the faster it is going to come back again.
Hmm. Right. So
So
as
it's
doctor has already mentioned.
recurrence rate is really high, and melasma patient is one patient who's never satisfied with the treatment and who
Hmm.
wants to keep they do this doctor shopping thinking it is they're going to get better remedy. It's just that wherever they go, it is going to be a process. It's just that, see, it's all about what they want. There are patients who say, I just want this pigmentation to fade to little lighter tone. Or there are patients who say, I just don't want this to increase. Or there are patients who
Hmm.
say, I want this to fade completely. The treatment depends upon that. So we really ask the question, what do you want? That's what. You want us to
Right.
fade? Yeah, we'll help you doing it. We'll fade the pigmentation, but you need to understand the disease. So when the patient understands what it is, how it is, it's very easier to explain to them. It's when we set unrealistic expectations, saying I'm going to just make it go, you'll be fine forever. That's when all the trouble gets invited.
Right. But what are the treatments normally which are available? What is
Yes.
the first line treatment? What can be the advanced treatments which are available?
So for protection level, we give sunscreen and oral antioxidants. To treat the pigmentation, we go for all depigmenting agents, which I've mentioned already. And there are treatments like procedures. We go for chemical peels, laser, and there are
Hmm.
injectables like regenerative medicine, where we take the patient's own blood and infuse the growth. I mean, inject the growth factors, which also helps in melasma. And also counseling the patient about the triggering factors, like as in I already mentioned about hair dye, or they apply astringents, it's all going to be a triggering factor. They tend to not apply sunscreen when they're cooking also. Cooking oil also increases, the chance of the melasma severity. So we
Hmm.
clearly tell them counseling is very important when it comes to melasma patient, and followed by
Right.
all these topical. Topical is where we are asked them to apply it. Oral is antioxidants, and procedures is depending upon the severity, and the number of session also varies depending upon the type of melasma, and the response also is going to vary. Majorly, it's chemical peel and lasers, and also these regenerative medicine.
Right. Well, now I can see some questions coming up from the viewers. The first question is been asked by Kiran, who asks, "Is melasma more common in darker skin tones?"
Yeah, the thing is, darker skin tones, we are under darker skin. There are six type of skins, type 4, I mean, till type 6. Indian skin fall under the category of type 4, type 5, type 6. So we are little more prone to get pigmentation compared to other people.
Right. The next question comes from Ankita, who asks, "How can I use honey to treat melasma?"
Honey, lemon juice you can drink. It's a good source of antioxidants.
Right. The next question comes from Pinky, who asks, "Can lemon juice help lighten melasma, doctor?"
Good source of antioxidant. Again, the same reply. You can
Right.
drink lemon
Uh,
juice.
right. The next question comes from Jayanti, who asks, "How can I choose the right foundation shade for melasma?"
As I mentioned, choosing, like, you can go for tinted sunscreens, okay, which will match your skin tone. We have different shades these days, where beige, bronze. We have something in middle also. So you can choose something which because tinted sunscreen is going to give you protection against the sunscreen. I mean, against the sun exposure, as well as give you that foundation look. So I am not a person who really recommend makeup on regular basis, because these agents themselves can irritate their skin on a long term basis. So I asked them to go for a tinted sunscreen instead, and you can try the shades. Your doctor might give you options to try the shades, and then you can decide which one goes well for your skin tone.
Right. Doctor, we know that for the patients who are suffering from diabetes, any sort of condition looks a little different for them. It becomes a little difficult to get cured. What about melasma? Does melasma look little different for the patient who are suffering from diabetes or say thyroid?
Okay, so these patients are prone to get it at a earlier stage compared to others. That's it, because they have this other disease burden, okay, which the body has to handle. So this one gets the least priority for them. So they come at a later stage thinking they really need to take care of the skin, or they really do not care about this melasma, or these people they just accept the disease. That's what happens when it comes to these patients with thyroid and diabetic mellitus. But they are more prone to get it at an earlier stage. So all the studies are not much available on that, but that's how on real life scenario, that's what we see.
Right. Doctor, what about the ladies who have got after pregnancy, as you have mentioned that there are chances of the occurrence of the condition after pregnancy. So, is it possible that the condition disappears after pregnancy?
It is not like disappears, it generally fades after pregnancy with a good treatment options, and it has to be maintained again under control, because these patients are the ones who will also get melasma in later stages. Even if we
Right,
try to bring it under control now, so they need to be under regular protocol treatment protocol to keep it under check. It need not be procedures, it can be a good skin routine also. If it's very minimal, you can maintain with a good skin routine also.
right. What about hydration, doctor? We know hydration is very much important when we're talking about skin. Does Is it just the mark which is on the skin, or the skin also becomes dry and it needs more water to keep it, healthy all the time?
See, hydration of your skin is important in all term, not only for melasma. Okay, because that is what is going to give you nourishment. So probably a person, when I say melasma, it's all about postmenopause. I said it's very common among postmenopause. They already have a very dry skin because of their hormonal there's less hormone right after menopause, so you do not have the protection. So there's already dry skin, and on top of it you have melasma. It is going to look more prominent. Okay, well nourished skin having a melasma patch is going to look little, uniform compared to a person having a dry skin having melasma. That's all. So, but it doesn't have a direct relation, but it has a major impact on the response to the treatment. So, hydration plays a very major role in any skin condition or in any health diseases for as in for matter. But then you should not. It is not a direct determining factor for melasma. Something not direct, but it
Right,
has a very important role to play.
right. The next question, doctor, comes from Kirti, who asks, "Is yoga does yoga help with melasma and stress?"
Yoga helps with stress, and stress is where when there is less stress in your life, you need less amount of antioxidants. So all those antioxidants, whichever is available in your body, will help fighting the natural aging process. So you don't need all these supplements. That way, maybe it will help in with melasma, and probably you should do it indoor.
Right. The next question, doctor, comes from Sia, who asks, "What type of moisturizer should I use for melasma?"
See, it depends upon your skin type and also the treatment that has been given, because certain skin molecules which we give for melasma may cause dryness. So we determine depending upon the expected response as well as their skin type. A person who's already having dry skin, if I'm going to give certain molecule, I have to go on a very long hydrating moisturizer. So it completely varies and it depends upon an individual rather than a common term.
Right. But is it contagious? We know what a lot of people who also wonders because it's about skin, so they normally tend to scare to stick with the person or use the same stuff. Is it possible that it is contagious?
No, definitely melasma is not contagious. It is just that you have a family risk of getting it if you have a family history of melasma. Definitely not.
Right. Doctor, we had a wonderful discussion on melasma. It was very informative for our viewers today. Before we take a leave, any take home message for our viewers who has watched us so far?
Okay, patients, if you want me to tell one thing for patients with melasma, it is going to be a long journey with your doctor, and choose your doctor wisely, whether the person is a board certified dermatologist or not, and have a very realistic expectation. One product which will travel to prevent or to protect as well as to not get melasma is going to be a sunscreen. So be very religious with your application of sunscreen. That's it.
Well, that was the expert advice for today, and that was Dr. Mithra for us. Thank you so much, Doctor, for your
Thank
valuable
you.
time. It was
Thank
a
you for this
very
opportunity. It
informative
was lovely.
session, and we look forward to hear from you the next time very soon, maybe. And thank you,
Yeah.
viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page of Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe
Thank
and
you,
stay
ma'am. It was
healthy.
a lovely session. Thank you. Thank you for being a great host. Yeah.
Thank you so much, ma'am. Thank you.